Why do people in developing nations recover faster from schizophrenia? By Lobetos. Diagnosing in developing countries. In an old study, the International Pilot Study of Schizophrenia, researchers found that 2 years after an initial diagnosis of schizophrenia, patients looked better in Africa and India than they did in sites scattered throughout the West. But the results were reported in 1973. Some of the data was dubious, and clinicians had to use an older pre-DSM-3 definition of schizophrenia. The study was redone using 12 centers in 10 countries and a stricter diagnostic category, a clearer method, and a more careful analysis. After 2 and 10-year follow-ups, the results still held up, despite the concerns, criticisms, and the limitations of the data. No matter whether you look at symptoms, disability, clinical profile, or the ability to do productive work, people diagnosed with schizophrenia are far more likely to meet the criteria for recovery in the developing world than they do in the developed world. Many developing countries have far too few mental health professionals, reflecting the very low priority accorded to mental health by many governments. Less negative moral career. In India, unlike America, patients often live in joint families where they do not have to be primary breadwinners or primary caretakers to be useful members of the household. In India, entry-level work may be less stressful, less demanding than it is in America, where many such jobs are fast-paced and high-people contact settings like McDonald's. In India, fewer families exhibit expressed emotions than they do in America. Less stigma and isolation of ill because of greater tolerance of symptoms. In South India, where there is a wide variety of causal beliefs for their psychological disturbances, it is also shown that patients' views of schizophrenia do not concur with professional ideas. 70% of patients attribute schizophrenia to spiritual and mystical factors, whereas social and biological causes accounted for less than 20% of the overall attributed causes. From that 70%, about 50% believe that black magic was more often the sole cause of the illness, followed by disease 8%, evil spirits 4%, conflicts among relatives 0.8%, and relationship difficulties 0.8%. The most common combination was family, religious, and community support. Among the factors most commonly discussed are the facts that in India, the family remains fully involved in the treatment, unlike in America. Patients who had low rates of rehospitalization had an active religious life. In a British study, they found that for spiritual life to be of maximum benefit for people with schizophrenia, it must be disentangled from their illness. For example, engagement in a Christian charismatic group that was unaware of a patient's illness provided him with an opportunity to redefine himself as something other than an invalid, and provided him the space to consider himself as a worthwhile and effective person. Quicker return of normative activities such as household labor, work, social relations. Those who had the lowest rates of rehospitalization were found to frequent particular types of public locations. Examples include fast food restaurants, shopping malls, and outdoor squares. It's noted that visiting such places appeared to be meaningful for patients in the study and may have been constructed as a kind of metaphor of a relationship with the environment. Cost and effect of medications. In terms of availability of medication for treating schizophrenia in India, both first and second generation antipsychotics are available at fairly low prices. Both groups of drugs are being used as first-line medication. An example of an antipsychotic would be risperidone. India patients also require a much lower dosage of medications than patients in the West, in both acute and maintenance phases of treatment.